portion of Lifestyles is sponsored by Evansville Hearing Aid Center.
Amanda Bennett is back with us from Evansville Hearing Aids, and she's here to talk about, first of all, finding out when you know you need to start wearing hearing aids. Good morning.
Hello, how are you?
I am good, and of course this is a great topic to talk about. I think you've said this before, we wait too long so often before we even go get our hearing tested.
Absolutely. Most people wait between 7 and 10 years after noticing some sort of problems before coming to get the hearing tested. That's not necessarily a good thing, because what happens is the worse our hearing gets, the least we can get back. So the earlier you treat, the better, because we can treat the problem before it gets so bad we can't help it. So we definitely want you to come in, at least get a baseline hearing test. That doesn't mean you have to buy hearing aids. That just means that you know where you are. If you have a hearing loss, we'll talk about options and what we think the best, future is for you.
Amanda, when should we begin to have our hearing tested? Or should we just do that as part of our yearly checkup?
Yeah, we always say get your hearing tested yearly, especially if you're 50 or older. But even before that age, it's nice to have a baseline, because then you can see if it does start deteriorating and when it starts deteriorating. So there's no staple of when you have to come. The earlier the better. Like I said, if you're 20 and you want to get a baseline hearing test, that's great, because then this year it's fine. Next year we'll send you a letter and we'll just keep testing you to make sure everything's okay.
Well, I know, because of my own experience, we're not losing our hearing equally in both ears. So I'm sure you get this question, do you have to wear hearing aids in both ears?
90% of people do have to wear hearing aids in both ears. Our hearing loss, like you said, is different. Just like, sometimes you have one foot bigger than the other, or your eyesight's different from one eye to the other eye. Your hearing loss can be different from one ear to the other, but most of the time we have hearing loss in both ears, and most of the time they're pretty close, but, a little bit different. So if you have hearing loss in both ears, you want to wear hearing aids in both ears, because we're meant to hear equally out of both ears. We understand better using both ears. So like I said, 90% of people do need to wear both, but there is that 10% that does not have to wear two hearing aids.
All right, so when we come to you and we find out we need hearing aids and you've fitted us and we're good to go, are there any additional cost after we purchase those hearing aids?
Well, it kind of depends on, here, if you buy privately from me, with no insurance or anything like that, we bundle that cost. So we will take care of you. If it's something we can fix here in the office, there's no charge. Even after the warranty period, because, with hearing aids, you have a warranty. Most of the time it's 3 years. So even after that warranty period, we never charge you for an office visit, just to come in and get readjusted. Now, insurance plans, we have to follow their guidelines. So sometimes they will pay for a year of office visits, and sometimes they will only pay for 3 office visits. So if you come to us direct, no, you will not have very much additional cost at all. If you go through an insurance plan, we follow their plan of what they will pay for. So best to come see us and get your hearing checked out, and then we can check insurance and all that good stuff for the patient.
So let everybody know where you're located, Amanda.
We're located at 2424 Stringtown Road. It's just north of Diamond Avenue. And our telephone number is 812-424-5116.
All right, thank you. It's always good to talk to you, Amanda.
Thank you. Have a great day.
You too. More Lifestyles right after this. Stick around.
This portion of Lifestyles is sponsored by Evansville Hearing Aid Center.